It is that time of the week where we talk live with Dr. Isaac Bogoch about public health issues and infectious diseases specialist. Of course, he is at the Toronto General Hospital. Dr. Bogoch, we have talked to you a lot about measles lately, and there have now sadly been 3 deaths in the U.S. Now, cases here are rising. We've passed 660 in this province, but I want to point out not as quickly as they have for the past couple of weeks. So do you think we're past the worst of it here?
I sure hope so. I think this is something that's going to take a few weeks to really sort out, but it looks like things are leveling off. That's for sure. And obviously that's a good sign. But we really have to work to ensure that everyone who is not immune to measles, who's eligible for a vaccine, gets a vaccine, because we know that this is the type of infection that's just going to persist and grumble along if we don't block it with a wall of immunity. So I know there's been some significant efforts in Ontario, especially in southwestern Ontario, to work with the communities that are under-vaccinated where these outbreaks are occurring, and of course with other communities as well in Ontario to ensure that everyone's got access to this vaccine so that we just don't see outbreaks like this ever again.
When it comes to the measles outbreak south of the border, RFK Jr. visited the epicenter in Texas, and in a move that surprised a lot of people, Dr. Bogoch, he posted on X that the vaccine is, quote, the most effective way to prevent the spread of measles. So how important is a statement like that from RFK when you consider his opinions, history of opinions when it comes to vaccines?
Yeah, I mean, it's about time. Messages and strong rhetoric like that would be helpful years ago. And, in second place, it would be helpful at the start of the outbreak. But I guess it's still helpful now. It's never too late to parlay the right message, and I'm glad that's being parlayed. The vaccine has obviously decades of experience and use and safety data, and of experience understanding truly how effective it is. And if you want to quell an outbreak or even prevent an outbreak from happening in the first place, it's really important to ensure that you have good outreach, public trust in public health, ensuring that everyone has access to these vaccines, because quite frankly, you need rates of vaccinations in and around 95% to prevent chains of transmission from perpetuating. And in some of the communities in the United States, and sadly, even there's pockets in Canada where the rates of vaccines are rather low for measles. And we are at risk in certain areas in Canada and, of course, elsewhere in the United States and globally of transmission because of those low vaccine rates.
Yeah, we saw that chart we put up 2 weeks ago that you provided that, as of 1963, once the double vaccine came in, how low the rates went and how we're experiencing a bit of a comeback now. Let's turn to this, though. We've talked to you a lot about COVID over the years as well, Dr. Bogoch. New COVID variant in Australia called LP.8.1, an offshoot of Omicron. We know what Omicron was like. It's also responsible for a lot of new cases in the UK as well. So what do you know about this one, and is that a cause for concern here?
I think it's more of the same. We've been under this Omicron umbrella for ages now, it's been years, and we know the virus will continue to mutate, and we'll still see these subvariants. Now this is LP.8. And, to no one's surprise, people travel, and we know infections move with human mobility. We have this here in Ontario. And as of the last Ontario genomics report for COVID, LP8 has been seen. It's actually the most common sublineage of Omicron right now in Ontario at about 20% of all. And it's probably going to grow in size and dominate until something else rolls around. But if we take a step back and zoom out and look at what are the COVID rates in the province and in the country right now, it's actually very low. They've been dropping since January, and the percentage of positive tests right now is as low as it's been in ages. It's about 2.5%. Back in January, it was about 10%. As predicted, we will see ebbs and flows of COVID, and we'll see changing sublineages of Omicron emerge. And the newest one is going to be this LP8, it looks like.
All right. Well, the trend seems to be our friend right now. Dr. Bogoch, friend of the show. Always appreciate the time. We'll talk soon. Take care.
Have a great day. Thank you, Nick.